Welcome to demonstrating implementation excellence stream of the SNOMED CT Expo 2024. Thank you to FAST for sponsoring the stream. My name is Kai Cooley, and I'm the implementation support technical specialist at SNOMED International. I'll be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A button to type your questions to the presenter. And for on-site attendees, please use the microphone provided in the room. I'm now pleased to introduce Natalia Massaccesi from the Ministerio de Salud Deportes Mendoza from Argentina, who will be presenting effective integration of SNOMED CT into Mendoza's EHR, enhancing Argentina's public health system. Natalia, please go ahead.
Hello everyone, my name is Natalia Massaccesi and I'm going to present this implementation titled Effective Integration of SNOMED CT into Mendoza's Electronic Health Record, Enhancing Argentina's Public Health System. To provide some context, Argentina is a country located in the southern part of South America. It has 23 provinces and an estimated population of approximately 46 million people. Out of these 46 million, about 1.5 million people live in Mendoza. Regarding healthcare, Mendoza has a network of hospitals and health centers that serve both the local population and visitors. The province has reference hospitals in its various departments, as well as more than 200 primary healthcare centers that offer basic health services. It is important to highlight that Mendoza's healthcare system is a combination of both public and private services. In terms of digital transformation in healthcare, the approval of the law has achieved significant progress. This law establishes the regulatory framework for the implementation of digital systems and services, promoting the adoption of technologies that facilitate the management of health information for individuals, families, and communities, as well as the coordination among different actors in the healthcare system. The main purpose of this law is to improve patient accessibility and care through comprehensive management based on secure, updated, and reliable information and data, on which decisions can be made and public policies adapted to ensure the quality and equity of health services. The implementation of this strategy has the potential to revolutionize the way health services are provided, promoting a more modern, coordinated, and patient-centered system. HSI, Integrated Health Record, is used. Developed by the Pladema Institute of the Faculty of Exact Science at the National University of the Center of the Province of Buenos Aires. HSI is defined as a digital tool that seeks to organize, streamline, and improve work within health establishments. This tool is supported by the Ministry of Health of the Government of the Province of Buenos Aires, the Ministry of Health of the nation, and the Ministry of Health and Sport of the Government of Mendoza. In health information systems, emphasis is usually placed on the following areas. Functional. Its principle is to facilitate the capture, management, storage, and provision of data and information that can support the processes and function carried out in healthcare organizations. Interoperability and standards. An interoperable information system is one that has the ability to interact with other systems, exchanging and using the information they manage with the ability to interpret it. Information systems and interoperability play a crucial role in achieving more equitable, efficient, and effective health systems by eliminating existing barriers and providing accurate, high-quality information at the right time. Consequently, it is important to identify the level of interoperability being applied. The most commonly used standards are ICD-10, SNOMED CT, DICOM, LOINC, among others. For successful implementation, it is necessary to achieve organizational interoperability of the system with all healthcare centers. And security, it is essential that the electronic health records guarantees the privacy and confidentiality of information it contains by implementing appropriate mechanisms and elements. Therefore, the breaking the glass tool is proposed, where any professional accessing a user's medical record without an appointment or relationship with the user must record the reason for consulting that medical record. The aim is for each hospital to send the forms it uses for its various practices in order to generate standardized documents and homogenize the information obtained from each of them. The main objective is to generate benefits for the different actors in the healthcare sector. These are patient, promote self-care, health promotion and disease prevention, professional guided decision-making process in treatment, aiming to minimize errors in care processes and provide tools that facilitate continuous and comprehensive care. Director of establishment support their management with evidence, allowing them to improve clinical processes, human resource management, and the support of public health policies. And Minister of Health define public health policies that add greater value, improve the efficiency and equity of the system. HSI has various implementation models that allow for update reliable, complete, and timely information. These are patient management connected to the National Registry of Persons, RENAPER. It allows searching and viewing data of registered and unregistered patients, as well as performing new entries and registrations. Outpatient clinics, places where outpatient care is provided. Hospitalization allows managing patient admission to the facility, bed assignment, and complete recording of the patient progress until discharge. Emergency department, and additionally, it features electronic prescribing, which allows healthcare professionals to generate, transmit, and fill medical prescriptions electronically. All this data can be viewed through a control panel by the director of the establishment and the Minister of Health. This panel indicates the number of appointments assigned, confirmed, attended, and missed, as well as the number of medical records generated, professionals using the system, number of prescriptions created, among other parameters. Once the patient's medical record is complete in a specific hospital or primary healthcare center using the system, it becomes available in the patient's database to be consulted by any healthcare professional with access to that record in any other hospital or primary healthcare center using the HSI system. Therefore, this allows for the existence of platform interoperability. Out of the 23 hospitals, 18 are implementing the HSI system, although not fully, only in some modules. Out of the 200 primary healthcare centers, it is estimated that it has been implemented in 1/3. The objective of the project is to determine clinical standards for a coded language that can adjust to the needs of the Mendoza health system, being adaptable to medical records in outpatient clinics, hospitalization, and emergency systems. So, how are we using SNOMED in HSI? This tool allows us to implement the medical record in all hospitals in the province of Mendoza, as well as in primary healthcare centers. It has 4 main models: patient management, outpatient clinics, emergency department, and hospitalization, where we use SNOMED terminology in the last 3. In these modules, we have various files that are completed while attending to the patient, which use SNOMED terminology in Spanish. In them, you can indicate the reason for consultation, diagnosis, procedures, medication, allergies, vaccines, medical history, among others. Sometimes various healthcare professionals indicate that they cannot find some specific terminologies for their work. So an intensive search is carried out in the SNOMED search engine to find synonyms that replace them. If none of the synonyms satisfies the professional, the next step is to send a form to them to complete with the concept they want to add and its description, explaining the reasons and justification for the request. Once justified, it is sent to the SNOMED representatives for evaluation. Here is an example of how we look for reasons for consultation and medications. And here the procedures and the problems. This is the form where they have to complete with the concept they want to add and its description, explaining the reasons and justifications for the request. SNOMED CT was selected for the transition from ICD-10 to this terminology due to its ability to add significant value to patient medical records, as it links clinical conditions to the anatomical regions where the pathology occurs and its causes. This allows for a more comprehensive understanding of the patient health condition. The conclusions are standardization and homogenization. The implementation of a standardized form and the homogenization of information have proven essential for improving the quality and consistency of data in the healthcare sector. Multi-level benefits. The project has generated significant benefits for all stakeholders involved, from patients to establishment directors and the Ministry of Health, enhancing decision-making, resource management, and public policy formulation. Interoperability. The ability to access medical records across different healthcare centers has improved the continuity and quality of patient care, facilitating a more integrated and coordinated approach. And use of SNOMED CT, the transition to SNOMED CT has enabled more precise and detailed coding of clinical conditions, enhancing the understanding and management of patient health. The lessons learned were: first, the importance of training. It is crucial to provide continuous training to healthcare professionals on the use of new terminologies and systems to ensure effective adoption and minimize resistance to change. Second, flexibility and adaptability. The ability to adapt systems and terminologies to the specific needs of users is fundamental for their acceptance and success. The search for synonyms and the possibility of adding new terminologies are examples of this flexibility. Third, interinstitutional collaboration. Collaboration between different hospitals and primary healthcare centers is vital for the successful implementation of standardized systems. Communication and exchange of best practices can accelerate the adoption process and continuous improvement. Fourth, continuous evaluation and improvement. It is important to establish mechanisms for evaluation and feedback to identify areas for improvement and adjust systems and processes accordingly. This ensures that the systems evolve and adapt to the changing needs of the healthcare sector. And finally, technological support. Having robust and reliable technological support is essential for the implementation and continuous operation of health information system. Integration with national databases and the availability of real-time information are key aspects. If you have any questions, just let me know. Thank you very much for your attention.
Thank you. Natalia is joining us now from Argentina, and we'll take your questions. As a reminder, if you're in the room, please use the microphone to ask your question.
Hello, everyone. Do you hear me?
We do. Welcome.
Hi.
Are there any questions in the room? Otherwise, I've got a few. All right, I'll start us off then. What were the main challenges faced during the transition from ICD-10 to SNOMED CT, and how were they overcome?
Okay, for us, the transition from ICD-10 to SNOMED CT posed several challenges, including resistance to change from professional healthcare professionals who are used to the ICD-10 system and the complexity of SNOMED CT structures. Additionally, training was required for all the users to ensure proper adoption of the system. These challenges were overcome through continuous training programs, emphasizing the benefits of SNOMED CT and providing technical support during the transition. The flexibility of SNOMED with its capacity to incorporate new terms and adapt to specific needs also help the transition.
That's great, thank you. Yeah, there's a question in the room. Is there a microphone?
Are you still keeping the mapping to ICD-10 for reporting to public health nationally, or you just have the information in SNOMED?
We are using SNOMED in the hospitals where we are using HSI, and in other hospitals we are using ICD-10 at this moment. So now we are trying to make the transition for all the hospitals of the province and the health centers.
But if you need to report to national public health, you will use ICD-10 or SNOMED?
We use both of them. Now we are trying to use SNOMED because we were using ICD-10, but now we are using both. Perfect. And we explain that to the public health system.
Good.
That's quite progressive, actually, to do national reporting with SNOMED.
Yeah.
I had a question about the training for clinicians. Was it training more about the understanding of why it's important to record with SNOMED, or is it more about the usability and the practical data input?
It's important, both things, because the professional doesn't know how it works, SNOMED, how it works. So we're trying to train them in all the system, not only in one thing. So we need them to understand everything of SNOMED to use the system.
Are there any other questions in the room? All right. I've got another one, kind of a key one. How has integration with SNOMED CT specifically improved patient outcomes and healthcare delivery in the Mendoza healthcare system?
Okay, for us, SNOMED has significantly improved the patient outcomes and the healthcare in the province by trying to enabling more precise diagnosis. So we use better coordination of cares and enhance decision making through real-time information. And the access to update clinical data, and the integration of SNOMED CT has also facilitated us the institutional collaboration, allowing the healthcare providers across the different levels of care to communicate using this standardized language and improving the continuity of the care and patient security and safety.
That's great. It sounds like you're realizing a lot of benefits. And a final question from me then, what steps are being taken to ensure there's continuous updates and accuracy of the terminology as new medical knowledge emerges?
Okay, to ensure the continuous updates and accuracy of SNOMED, continuous feedback from professionals of healthcare is encouraged, ensuring that the system adapts to their needs and their medical progress.
That's wonderful. Thank you so much for your presentation. With that, we'll conclude the session. Okay. Online delegates, so welcome to stay here for the next presentation in this stream.
Thank you very much for your...
Or access another session through the event lobby.